Welcome, everyone. My name is Amy Hagopian. I'll be your host today. I'm a professor at the University of Washington and a co-founder of the Global Alliance on War, Conflict, and Health, which is sponsoring today's webinar. We're so glad you joined us. Our alliance seeks to advance this field of scholarship and practice to provide leadership, promote equitable partnerships, and amplify the voices of those most affected by war and conflict. We formally launched this organization with a webinar in the summer of 2022. We now have more than 100 member organizations from academia, humanitarian organizations, and journals. We have a website where you can find information on how to join the Alliance yourself. We look forward to creating working groups on our platform where you can find collaborators on war and health projects, so stay tuned for that. This is our seventh, I believe, in our webinar series. The first was on explosive events in urban areas. The second was on health systems in the context of the war in Ukraine. The third was on America's footprint in African wars. In November, we had a session on the long legacy of nuclear weapons production and testing and lingering health harms. Our fifth webinar was with Dr. Yara Asi, who has written a book called How War Kills, and our most recent event covered what's happening in Sudan from a health systems point of view. Those recordings are all on our website. I'd like to thank 4 people who made today's webinar possible, in addition to the participants themselves. Becky Brown with Southampton University, Elsara Badri, who works from Mozambique on our alliance, and very importantly, Stephanie Endo, who is an MPH student at George Washington University. She does the coordinating for these events. I'd also like to thank Samer Jabour, my co-chair. I'll be your moderator for today's event. In full disclosure, I will tell you I am particularly attached to one of today's presenters who is my student at the University of Washington. Our webinar series will take a pause for the summer, and we will resume in the autumn with a seminar on Syria. Today, we cast our gaze on Myanmar, also known as Burma. A rising civil disobedience movement there is working to resist the military government, which overthrew a democratically elected government in February of 2021. Health workers there have formed a resistance health system, part of the National Unity Government, and we are going to hear about how they have gone about organizing this remarkable parallel health system. We have 3 speakers today. It's not without risk that they are joining us, given the power of the military in Myanmar. So please bear with us as we have advised 2 of our speakers they may join without live camera. We will be recording, however, and will post this event on our usual page on the website. First, we hear from Dr. Therapy Su, who holds an MBBS and a PhD degree. She is a public health professional who obtained her PhD from an international university, and she's permanent secretary of the National Unity Government's Ministry of Health in Myanmar. Her special interests are health system strengthening and the role of community-based organizations, ethnic health organizations, and community health systems in complex emergencies. Her key role is facilitating and coordinating among key stakeholders in providing essential health services for the people. In this webinar, she will overview the health situations and healthcare provision by the Unity Government's Ministry of Health in collaboration with community-based organizations. Dr. Ethan is a key figure within the State Health Administration team of Sagaing region in Myanmar, which operates under the management of the Unity Government's Ministry of Health. He brings exceptional leadership and expertise to healthcare management. His educational journey culminated in earning a doctorate degree in Myanmar. Dr. Ethan's career is characterized by his unwavering commitment to improving health outcomes. His significant contributions have had a profound effect on the healthcare system in Myanmar, especially in the Sagaing region, an area particularly conflict affected. Today, he will present the health situations in the region and the activities of the regional state health administration team. Dr. Kaung Myatu is a graduate student and Fulbright scholar from Myanmar, currently pursuing a Master of Public Health at the University of Washington. He earned a medical degree in 2013 and a master's in preventive and tropical medicine in 2017 from the University of Medicine, Mandalay, Myanmar. His previous work experience includes roles in non-government organization, a government hospital, medical and community health, universities, and a research institute in Myanmar. For his master's degree thesis, he is studying the health crisis in Sagaing region of Myanmar. In this webinar, he will share some of the latest findings from that study, providing our wonderful audience with valuable insights into the current health situation in the region. So there's your summary of who they are. And for housekeeping purposes, we're going to have our audience muted and cameras turned off, but we will be recording, and the recording will be available for viewing on our website later. During the webinar, please post your questions or comments in the Q&A feature, and we will harvest your questions during the Q&A section of today's presentation. Thank you very much, and let me turn this over to Dr. Therapy. And I'm going to stop sharing so you can start sharing.
Thank you, Amy, for the very comprehensive introduction and the background of the country situation. Yeah, thank you. So I'm going to present the overall situation of the health and also how we are providing the health services during conflict emergencies after the coup. So this is the outline of my presentation. Firstly, briefly about the political and health situation in Myanmar after the coup and the challenges and health service delivery and our achievements. And finally, key messages for the international community. So in 2021, there's a military coup and there's a deep political and economic and humanitarian crisis affecting all key sectors, including health. It results disruptions severely hamper health service delivery, including the communicable diseases such as TB, HIV, malaria, and maternal and child health services, exacerbating by the COVID-19 and deepening Myanmar's recession. There's an 18% drop in GDP in 2021. On top of that, repeated waves of the COVID-19 in 2021 and 22 seriously disrupt our health services. And there's a humanitarian crisis, rise health needs in Myanmar, 2.8 million IDP across Myanmar and 1.7 million people displaced after the coup. More than 75,000 civilian properties, homes were burned or destroyed by the junta. And Myanmar military is solely responsible for the humanitarian crisis as a result of targeted attack to the civilians and the healthcare professionals. I would like to highlight about the CDM, civil disobedience movement among our health professionals. CDM in our country, predominantly led by the health professional, has been a powerful force in the aftermath of the military coup. So these dedicated individuals who have not only bravely resisted the coup, but also continue delivering essential health services to their communities. Simultaneously, they have advocated for the democracy and the restoration of the civilian rule. As a result, they are being targeted by the military. Up to now, we have more than 45,000 CDM health workers. There is a targeted attack to the healthcare by Myanmar military. This data shows for the 2023, and also explosive weapons used embedding healthcare in Myanmar, especially in the northern Sagaing, Kaya, Karenni, and other part of the country. So military junta has brutally killed 104 healthcare workers, arrested more than 900 healthcare workers, and attacked and destroyed 332 health facilities. Actually, these data are underreported, and there are many unreported evidence from the ground. So this is some of the example of the military attack to the health facility in Magui hospital bill donated by the JECA. And this is in Park Home Township in April. And also recently, there are many attacks to our health facility in Sagaing, Chin, Rakhine, and Kachin State. On the other hand, we have more controlled areas of ethnic revolutionary organization and national unity government indicate more basic health service needed for the civilian people. You can obviously see there's a shrinking territory of the control by the junta. So we have faced many challenges. Some private clinics and hospitals were also forcefully stopped from the operating by the SAC, and health facilities are being regarded as a military targets by the SAC and facing the high risk of airstrike. Also, the supply chain management and logistics of medicine commodities are still very challenging. SAC is like weaponizing the medicines and the medical equipment, so it is very difficult for us to transport from one place to another. And mental health has become a prominent issue due to the ongoing conflict, loss, and the great sense of insecurity. Also, the infectious and communicable diseases have been on the rising trend again due to the armed conflicts. And unreliable internet and phone lines pose a huge threat to the timely data collection and communication among our teams and reporting mechanisms. Despite of the challenges, we also have some enabling factors. Coordination is the key between the NUG, EHO, CSO, and international actors and local community. So we focus mainly on primary healthcare and emergency health services. And we also use innovative approaches to reach to our people. And we use a community health system strengthening led by our local community. For the health infrastructure, we have 77 hospitals, 377 fixed clinics, and more than 250 mobile clinics. So this figure shows health service provision for 3 years. Actually, this is also underreported because only 1/3 of the health facility is regular reporting. So the actual service data and performance will be 3 times higher than this data. And there are some evidence in the international media how we are providing the emergency healthcare, surgery, safe delivery, and well-wounded people. Another innovative way is telehealth. So we have a Telecama online, free online clinics, and over the last 3 years, telehealth clinic has witnessed 2.54 increase in patient access, and it is used by the 97% of the township within Myanmar and 43 countries outside our country. We also provide health education and the health literacy promotion through the online media, through the MOE's Facebook page and Telisama Facebook page and COVID-19 Knowledge Center. There is also activities for the online and on-ground medical education and capacity building for the healthcare professionals. For the research and development, we provide some of the research capacity strengthening training, and also we have a ethics review committee and health information system for the essential minimum variables. Regarding the international coordination, Ministry of Health has established dialogues and coordination platform with the international donors, UN agencies, partner countries, bilateral organizations, and INGOs. So this platform has bridged the international support, both technical and financial, to the implementing health organizations in states and regions. So these are some significant factors for successful implementation of health service provision during the conflict emergencies, although we have several challenges. We do have a strong CDM health workforce, and we also use innovative approach and technology like the telehealth and emergency online 24/7 consultations, mobile clinics, systematic coordination mechanism, and visible role of the MOH and UG, ethnic health organization, community-based organizations, and other key stakeholders. We encourage a localization approach and highlighting the important role of the CBO and CSO and flexibility of the SAM donor requirement during the complex emergencies, and assistance directed towards the communities in conflict-affected areas and ethnic minorities through the cross-border approach, avoiding the SEC and its partners. So let me convey some of the key messages to the international community. Urgent protection is needed. Healthcare in Myanmar is under direct attack, and immediate international attention is required to protect our health professionals and families from the violence. To safeguard the health services, we call for robust international measures to safeguard the hospitals and health workers who are crucial for the civilian care among these conflicts, and accelerate the humanitarian aid, prioritize and expedite humanitarian health assistance to reach the most vulnerable population in Myanmar without delay. Document and expose crisis. Support is essential for documenting and analyzing Myanmar health crisis. Accurate data is critical for effective global response and advocacy. And advocate for the health rights. The international community must advocate for the protection of civilian lives and ensure the uninterrupted delivery of healthcare among ongoing conflict by all the innovative ways. So that's all my presentation, and thank you so much for your kind attention.
Thank you, Dr. Therapy. That was wonderful. How about you, Dr. Ethan? Will you go next?
Yes, thanks, Amy. Let me share my screen. Good morning and good evening to all. I am Dr. Ethan, and I am one of the stakeholders of the Sagaing region in the State Health Administration team in Myanmar. And I would like to say thank you to Global Alliance on War, Conflict, and Health, and Professor Amy and our colleagues, Dr. Khan, for giving me a chance to share our experience and our challenges in our Sagaing region. Let me go straight to my presentation. And this is a recent photo of our Sagaing region, and you can see clearly that just you can see the smoke. The SAC Myanmar military soldiers, they are burning down the villagers' house and properties. So this is my outline, and I will cover humanitarian situation update in Sagaing region and attack to healthcare provision in Sagaing region and challenges and gaps. Let me start with the background of our forgotten region, the Sagaing. As you know that Myanmar, which is located between India and China, and our Sagaing region is connected with India, and we have a huge size of region, which is amount to 93,000 kilometers square. It is quite huge, and there are almost 95 countries which are smaller than our region. So our region is quite huge, and because according to 2024, our population at almost 6 million, male almost 3 and female 3. But although our region is a huge, and our country is beautiful, but right now, what is happening in our Sagaing region? This is the data from the UN Myanmar, and here the biggest circle in Myanmar is our region, and In our country, nationwide, the IDP is almost 3.2, and we have almost 1.2, which is amount to almost half of the nationwide. And it is interesting that there was 0 IDP before the coup. That amount of IDP, more than 1 million, appeared within 3 years after Myanmar military coup. And you can also see the trend here, February 2021 to March 2024. It is uprising significantly. Why? Why we are suffering a lot like this? The main reason, according to the UN OCHA, in the Northwest, key drivers of displacement of and humanitarian needs include regular airstrikes and armed clashes, killing and mining of civilians, military raids into villages, use of landmines and explosive remnants of war, arbitrary arrests and detentions, destruction of civilian properties, including rural health clinics and community schools, movement restrictions, and finally, blockage of supplies transport. The main root cause of such kind of terrible humanitarian crisis is Myanmar military, State Administration Council of Myanmar, and they are the root cause. You can see the picture, the book, and the school bag, but you can also the bloodshed on the floor. It happened in 2023. SAC soldiers raided on a primary school and killed more than 10 kids in that terrible tragedy. So this is the insecurity insight data. And the incidents, it's an incidents more than 1,000 incidents, violence against or obstruction of healthcare in the country. And the healthcare workers, almost 900 healthcare workers has been arrested. And if they are arrested, they're given sentences to 3 to 25 years. I have a colleague. He was detained and sentenced to 25 years. Unfortunately, he was killed by the SAC during the transportation from one prison to another, the arrangement of Myanmar military. And healthcare facilities are frequently raided by the military so far. This is from the media. Myanmar junta troops set fire to clinic, homes, and Sagaing region, Putalin Township. This is the photo we have got received from the Children Medical and Humanitarian Network, which is the largest organization in Sagaing region. And according to their photos, you can see clearly that SAC banned down the processed beds, medical equipments, and they also banned down the villages and clinic as well. This is the photo last 1 week ago, and SAC in the morning, SAC with the 100 soldiers, they raided the approach to the village and killed more than 30 civilians, including 3 women, 3 children, and elderly people up to 88 years. It happened last week in our Sagaing region, and they also burned down our villages. But we have nothing. If we can run, we will survive. If we can't run, we will be killed by the Myanmar military soldiers. It is happening in our Sagaing region. Under such kind of terrible situation, we could have provide the healthcare provisions and a deadly threat. Luckily, we could have collected data systematically as much as we can. According to the data from 2021 April to March 2024, we could have done more than 600,000 consultations, and we could have done minor surgeries, almost 30,000, and major surgeries, more than 5,000 patients. And we also provide rehabilitation services to the people with disability, almost 200 disabled patients for prosthesis. And we also provide safe delivery for mothers, almost 10,000 pregnant women, and antenatal care of more than 40,000 consultations. We also try to reach out to the school head, in which we can provide more than 50,000 students in 429 schools. We also have collected data systematically with the data studio, and here in 2024 January, in the FIS clinics, we could have provided in our Sagaing region, we could have provided almost 50,000 consultations in January 2024. This is the photo session of how are we providing healthcare service to our vulnerable community. Healthcare. We also we are providing healthcare service to the community, from the infants to the elderly patients as much as we can, including rehabilitation service with provision of prosthetics and rehabilitation service to the vulnerable kids. So let me finish with the challenges and gap. As you all know that according to our presentation, and you all can find easily in the internet that the Myanmar military continuously attack to healthcare providers as well to the community and committing crimes against community clearly. But the war can't do anything. But although I think they are trying their best, but we are suffering a lot day by day. And we have no security for our healthcare providers and as well for our community. And logistics supply, the SAC checkpoints, they don't allow medical equipments and medical supplies. So, but we could have overcome such kind of challenges with the involvement of local community. And in communication, the SAC cut on the mobile and internet so that the world were not seeing the crimes against humanity. But we are trying to overcome such challenges as much as we can to continue our healthcare provision. We need fund because the need is quite huge. Right now, we could have done such kind of healthcare activities with the international organization and donors, but we still need fund because the fund is very limited. That's why I'm here and I'm share our our situation in Sagaing and our healthcare provision achievement leaders, so that the international will get more attention, and hoping your support to your support. Thanks a lot. And this is my entire presentation. I'm happy to have questions from your side. Thanks. Thanks, Amy. The floor is yours.
Thank you, Dr. Ethan. And next, let us turn to Kaung, Dr. Tu. Would you, just a note to the audience, we now have 59 people in the room, which is a lovely audience. It's wonderful to have you all here. And you are more than welcome to enter your questions in the Q&A. We will have a Q&A section after Dr. Tu speaks.
Thank you, Amy. Let me quickly pull up my screen. Hello, everyone. Good morning, good afternoon, and good evening. So first, I'd like to say thanks to Global Alliance on Work, Conflict, and Health for inviting me to this webinar and allowing me to share my experiences. In this section, I'd like to share some relevant findings from my recent research in Sagaing region, which I did for my master's thesis, which is chaired by my brilliant professor, Dr. Amy Hagobian. Thank you so much, Amy. So my study tried to provide insights into the prevailing health problems in Sagaing region since the coup and the conflicts, and the sources and patterns of available health services in the region, and also the challenges the healthcare providers and the community members are facing in their healthcare provision and utilization. And I studied these from the experiences and perspectives of the anti-haunted healthcare providers and the community members. So I conducted a qualitative semi-structured in-depth interview with 26 healthcare providers and 6 community members from 10 different townships of the region. I did it through online platforms such as Zoom, Signal, and Telegram. So from my study, I found in the Sagaing region after the coup and the conflicts, pre-existing health problems, including the infectious diseases such as TB and HIV, and non-communicable diseases such as diabetes and hypertension have been exacerbated. It was also reflected in Dr. Therapy's presentation. In addition, new health problems, particularly conflict-related injuries and mental health problems, have also been arising. Moreover, the conflict settings have also complicated the problems of snake bites, childbirths, and other emergencies like appendicitis. And limited access to proper healthcare also forced people to seek care from non-professional and qualified healthcare provider, which is rarely available in their community. So before going to the new healthcare landscapes in the region, I would like to introduce you to the healthcare systems in Myanmar before the coup. As you see in the picture, we have the government of the public sector at different levels of care in blue, and the private non-profit sector, which include NGOs and charity clinics in green and orange in the middle, and the private for-profit sector, which include the private hospitals and specialty clinics and GB clinics in orange and pink. And we also have the ethnic health organizations in Myanmar, but they're not common in the Sagaing region. So before the coup, they cover both urban and rural areas at different levels of care. So these are the two distinct healthcare landscapes in the Sagaing region in the present setting. As you see on the left side of the spectrum, in urban area, which is mostly under the hunter control, the healthcare providers remain unchanged as before the coup. However, the capacity of the government hospitals and the public health departments had significantly reduced, and they also have lost people trust. Then the demand has totally shifted to the private providers, particularly to the for-profit private hospitals and specialty clinics and general practitioners. And like in urban areas, in rural areas, most of which are under the control of the resistant forces, the healthcare patterns have completely changed. Before the coup, the rural areas relied primarily on the government rural health centers and partly on the NGO services. Because of the CDM, as Therapy discussed, almost all of the rural health centers, except in a very few per 100 villages, have completely stopped functioning. And the NGOs also cannot effectively run their rural programs because of the hunter control. And also, they lost people trust at their end of the hunter's control. So there was a big gap in the healthcare of rural areas, and the gap got bigger because of the increasing conflict as Dr. Edens discussed. And later, the CDM healthcare workers who have fled to the rural areas to avoid the hunters' arrest, and they started healthcare in the rural areas. And they started individually, but later they made teams with other providers in the team, and now they have evolved into proper healthcare teams in the rural areas, as you have seen in the presentation of the other two speakers. And now, and also new community-based health organization, most significantly, Genuine Medicaid and Humanitarian Network for the Sagaing region, and the CBHO, which function similar to the NGOs, have also emerged in the region. Later, the NUG Ministry of Health, which therapy is from, and State Health Administration team for the Sagaing region, which Eden is from, they later organized the new local healthcare teams for rural areas and oversee their services. So these new providers are usually based in remote rural areas where the hunters cannot easily reach. And the CDM healthcare staffs are leading the teams, and they also have the CDM medical and nursing students and other volunteer healthcare professionals and trained health volunteers to support the team. And these are new healthcare teams can take various model, such as a hospital with both inpatient and outpatient facilities, sometimes including an operation theater, or can also be settled or mobile clinics with outpatient facility only, or they can also be a network of providers scattered across villages. And these teams are providing both clinical care and public health services to the local communities. And I will not give you the details as Dr. Therapy and Dr. Ethan have already covered them all. But here I would like to highlight one of my findings. Are some secondary and most tertiary level care is still limited in the rural areas provided by these providers. And so these providers will need to refer such patient to other providers in other areas where the service is available, or probably to the provider in the urban areas, most probably to the private hospitals. And these are the public health services provided by these new healthcare provider, which is also covered by other speakers. Here, I would like to highlight that their public health services are also limited because of many challenges. But it doesn't mean that their success is little, because they have started from zero. And these diagrams display the challenges in the healthcare provision and access as reported by the study participants. As you see in the picture, all the challenges come from three major drivers. First, because of the deteriorating national economy, as Dr. Therapy discussed, more people become poor and they face multiple hardships. So people cannot afford healthcare, and healthcare is not their priority anymore. And next, frequent offensives by the hunter military have displaced people, as you have seen in Dr. Ethan's slides. And then people are living in conditions unfavorable for their health. And as the hunter attacks healthcare facilities and healthcare workers, so then the safety of the healthcare workers and the patient has become a great concern. And the hunters has restricted all the resources flowing into the resistant area. The hunter restricts travel and transportation, so restricting access to healthcare and also preventing the transportation of medicines and other medical supplies to the local healthcare teams. And the hunter sees all incoming international aid, both funding and commodities. In addition, the hunter has restricted or totally shut down phone and internet access in the Sagaing region, especially in the rural areas, so people cannot communicate for healthcare and safety. And it also limits the use of telehealthcare, which Dr. Therapies mentioned. And all these factors have caused insufficient health workforce and funding and commodity, and also cause severe limitation in the provision and access of healthcare. So to sum this up, we can conclude that the health status and the healthcare systems in the Sagaing region have been devastated by the military coup and the following conflicts, particularly affecting the rural populations. And the anti-Hondo healthcare providers have established new healthcare system for the rural population, but they're still facing many barriers, and these barriers are still hindering their efforts. So immediate action is required to remedy the situation before it gets worse. Here I have picked the 6 most important and urgent gaps in the Sagaing region's healthcare, and also made recommendations to improve these. First, the rural population needs proper secondary and tertiary care. I mean proper secondary and tertiary care. It should be available locally as travel restrictions are severe. I think upgrading the newly emerged healthcare providers can be a solution. And next, organized public health programs should be restarted or enhanced, especially for the rural population. And I think NGOs and international donors can directly engage and collaborate with new local healthcare teams who are trusted by the local community. And also the new teams train healthcare volunteers. They still need professional healthcare workers, so they can provide multidisciplinary care, such as an anesthesiologist. I think establishing accredited medical and nursing school in the resistant area can be a solution. I think it is also happening in many other resistant areas across the country. For the financial and commodity support, I recommend international aid agencies to directly support local health actors, probably through the community-based health organization who are overseeing the healthcare services in the area, and bypass the hunter, absolutely. And the local healthcare teams have already created channel to do this. And although the study participants didn't present it as an urgent problem, a well-organized health information system is missing in the newly developed healthcare system. It'll also need to solve the problem of internet accessibility. But the NUG MOH, Sagaing SHAT, and China American Health Networks have started their initiative for this, but they need more support for a more efficient action. And lastly, the new system needs improved governance and strategic leadership. It's also very difficult in this kind of setting. And the study participant are requested to establish a region-wide authoritative body policies and protocols for more efficient operations. And as you have seen in therapies in Ethan's presentation, the NUG MOH is the State Health Administration team and the China Medical and Health Networks have started this initiative already. But I believe they still require more support from the international community, and the support can be technical, financial, material, or political supports. And finally, I would like to thank all these people and organizations who have greatly contributed to my study. I must admit, without their help, and my study wouldn't have happened. So that's all from me. Thank you so much for your attention. Now, I'll give the stage back to Amy. Over to you, Amy.
Thank you so much, Dr. Tu, and thank you to all 3 of our wonderful presenters today. Let me start with asking a question, maybe of Dr. Therapy. You spoke about there being thousands of healthcare workers who are part of the national unity government and working in this area, and that 1,000 of them nearly have been arrested, which is quite a remarkable thing, and obviously indicates it takes people who are willing to subject themselves to this sort of risk to provide care to their communities. And I wonder if you could describe a bit how the unity government goes about providing security? Have you hired personnel to guard facilities, or how do you protect your health workers in such settings of risk?
Thank you, Amy. As we all see, they are actually our health professionals risking their lives and saving our people. So from our Ministry of Health, together with the other aligned ministry, we have some protection on the ground team for the healthcare facilities. And also we provide some of the training, like how to communicate for the airstrike emergency alert system. And we also have an emergency operating center, which is 24/7 available to communicate among us. But as we already discussed, the internet and the phone line communication is also a big challenge. But we also provide some of the training for how to avoid the airstrike and how to run the system, and also the emergency escape plan, because we already try to hidden the health facility places as well, because previous health facilities location, the SAC has already got according to the coordinate and the exact location for. Therefore, for the previous health facility and the center, they already have a specific location information, so they can do the airstrike anytime. So we advise not to use that obvious health facilities and to use in the hidden places secretly. And also we also suggest to keep confidential for the health services, especially for the people defense forces and the community, because in the community we don't know who is from which side. So that kind of security is also trying to prevent. But even then, we cannot prevent the airstrike, because some of the countries are selling the fuel and also supporting the military for the weapons. So we cannot totally prevent the airstrike and for the targeting our health facility and the health professional. So we are advocating all the international and the other countries not to collaborate with SAC, especially to kill our people. So that is our key message for the international community. And we also provide some of the training for the digital security and the
Yes, it's a remarkably sophisticated operation you have to run to protect people. And, you know, I am, of course, curious, what are the countries supporting the military in its capacity to attack healthcare, since that is an illegal violation of international human rights law. But I won't challenge you with that question. I do notice your very long border with India, and I wonder if you get any support for your health system from the country of India. Can anyone answer that?
Can I start, and Dr. Ethan can also add, because the Sagaing
Yes.
is also not far from the Indian border. But we do have some dialogue with the Indian government at the ministry level, Ministry of Foreign Affairs. But unfortunately, we haven't got any supportive measures from the Indian government yet. Also, although some of the local government is helping our people along the Chin and the Mizoram area. So that's what I could
Yeah,
tell.
so it's local government to local government, even if the national government of India is not of much use. Okay. I'm still looking for questions in the Q&A. So are the National Unity Government healthcare workers volunteers, or are they paid? And you might speak to how do you finance such a large operation? Kaung, would you like to answer that?
Yeah, I'll start first, and Dr. Therapy and Dr. Ethan can add more later. And yeah, they're fully volunteer and they're not paid. They receive some financial incentive. It was 3,000 to 5,000. Sorry, 30,000, 50,000 or 70,000 MMK, which is just now with the current exchange rate, it was only 15 around 20 each USD every month. So there can also be disruption.
Very modest.
Yeah.
Mhm.
So yeah, if you want to Matarapi and Sia Ethan, you can add more. And especially elaborating on the financing of the whole operation.
Yes. Dr. Therapy did answer one of the questions in the Q&A about how people can support the unity government by providing a link for the contribution. Marion Birch asks, have you had any support to continue immunization services in your areas from the UN or other international bodies? Dr. Ethan or Dr. Therapy?
Dr. Ethan can go, yeah, but I can also add some points, especially for the childhood immunization. Yeah. Dr. Ethan, would you like to go first?
Thanks a lot. Yeah. Thanks for your question. We have actually we did two pilot immunization service to our region and unfortunately, I mean, we don't have proper support from the international community, UN agency in 2022 and 2023. Right now, we have some very few informal communication with the responsible UN agency for the immunization, but it is ongoing process for that negotiation for the immunization. Right now, our children especially in the rural area, as Count mentioned, this is the zero dose for the immunization in rural area. So it goes about to more than 3 years, maybe 5 years because of the COVID-19. So it kind of challenging for us to, to get the immunization service. The main problem is the SAC, Myanmar military, Myanmar junta. They block the logistic supplies, not just the immunization, but also the healthcare supplies. So it's kind of challenging, not just on the immunization, but like in 3 disease, in HIV and ART and anti-malaria medicines and TB, the SAC don't allow to go to the rural area, which they thought that covered by controlled by the national unity government. So that is too, devastating to have such kind of enemy in our country. Ma, could you please add more?
Thank you. For the immunization, it is our priority needs, and because we haven't got the immunization more than 3 years, including the COVID and the coup, and regarding the UN agencies who are responsible for the childhood immunization, we do have some dialogue, but no action yet. So the action is very slow, and we have human resources for the immunization. We don't need any training because we have many CDM health workers on the ground. And some of the international organizations also provide the infrastructure like a cold chain or the some of the travel allowance, but they cannot provide the vaccine. So for the vaccine itself is a huge challenge, because if we have to buy the vaccine from the market, it is 7 times higher price than the government price. So it is not possible to cover all the children to get the vaccine from few international donations. So we do need to accelerate and push the responsible UN agencies for the childhood vaccination, because vaccination is the children's right. So yeah, that's for the
And is
vaccine.
that a way in which supporters could help, is by advocating in that way? You said earlier in your presentation that people could advocate for you, but we need
Yes.
to know how.
Actually, for the vaccination, the most of the international community thought we could get from the responsible UN agencies, but they are working very slow. They are working like as a routine system, not in an innovative way, like other institutional donors are doing the cross-border transportation and the providing the medical supplies and equipments, and also not going through all their financial and the supply chain system formally. They give some flexibility for the procurement system and also the transportation system for other essential medicine. But for the vaccine, we cannot get that kind of flexibility and innovative ways yet.
Okay, quick question on who are the ethnic providers? What is that unit?
Yes, we do have ethnic health organizations. Some of them have already formed before the code in their local area, and they already been trained for the healthcare provision. And before the coup, we have a plan for the convergence of the healthcare providers with our MOHS system and the EHO. So, but when the coup happened, we cannot do that kind of convergence system yet, but they do have their own health system and healthcare providers, and now we are collaborating with them, and we also provide some of the capacity building and also provide some medicines, and also our CDM healthcare workers are working in the ethnic areas. So they do have some human resources as well. Thank you.
Very good. And then, Kang, maybe you could answer John Chu's question about mental health concerns and how these are being managed. Are there any inpatient services? Are there outpatient services? Are there drug therapies available? And what might be a culturally relevant way to manage mental health concerns in this setting?
Okay, thank you. It's a really good and important question, Junju. Thank you. So people like for the mental health, people are now facing like multiple hardships economically, safety, security, and survival is their first priority. And they have experienced the big tragedy during the COVID pandemic. And then in the middle of the pandemic, the coup happened and the crisis happened, and people are now feeling of hopelessness, and because of the COVID, and also more importantly, because of the crisis, especially in Sagaing region and other border area with the most severe conflicts, they have lost their property, like in the like burning, whole village burning of the hunter. They have lost their property and they have lost their loved one. So they're really devastated. And it some study participants also reported the increased number of I mean, in addition to the depression and chronic stress, they also reported increased number of suicides and domestic violence and things like that. And yeah, so it's really important. But like for mental health care, the resources also limited, and also including the professional and all the resources, they are all limited in this setting. And some can get counseling and other mental health support through telemedicine, but because of the internet shutdown, especially in Sagaing region and severe conflicts area, they cannot use telehealth. The use of telehealth is very limited in the rural areas of Sagaing regions, and it's alike to in other conflict area without good internet access. So, and they have they have to the local healthcare workers, they have to provide those people themselves with like mental health supports, and they also have they can also provide some medication for some people with like symptomatic for the symptomatic cases. And what's the other questions? I think Amatherapy have also also answer some of the questions. So clinical.
Are there any big foundations
I
that
covered,
give
yeah.
money?
Sorry, what was that, Amy?
Are there any big foundations that give money? That was a question from an anonymous attendee.
Oh, I
You
think
know, Gates or Clinton or any of those big groups.
Amatherapy, could you
Yes,
handle that?
as far as I know, not yet.
Yeah.
But some of the individual donations and some of the foundations are providing limited support. But for the security reason, I cannot spell out all the names, but not from the Bill Gates and the Netanyahu.
Yeah. Those would take a lot of bravery. All right. I am so thankful to all three of you and to Stephanie and Elsara for your support for this webinar today. I think you have shined a light on a crisis that's happening in a place that most of us in the West have little understanding of, and you've really helped us see into this situation in a way that's very important. So the Global Alliance appreciates you, and we will post this video on our website. We will host a session in the fall on Syria. We are also open to suggestions. If those of you in the audience have an idea for a webinar, please let us know. And go to our website, check it out, join us. Thank you so much, everybody. We're so grateful for your time and your work in this area. And I'm so impressed with the bravery and the organization and the hard work that's involved in delivering services in the face of a murderous military coup. This is very impressive work. Thank you.